I think one of the things, just in my personal experience in global health, I think one of the things that has been lacking all too much is just the initial conversation of why we're here to begin with, why we care about issues of global health and equity. And so what I wanted to do was just create a space for all of our clusters to discuss a few of these issues, and we've put together a few guiding questions. So that'll be the majority of this workshop, is just having that discussion. But I first wanted to tell a quick story to kind of just set the stage. And this might be a story that some in this room are familiar with, and if it is, I think it's good if you're familiar with it already. If not, and if you are, it's a story that's worth being retold over and over again. And so the story begins in Haiti, and Truman State University, I don't think we have any of them here yet, but they work with a great organization in Haiti, and this is this is a different clinic in Haiti, though. The clinic, which I'm going to talk about, is in Las Caubas, Haiti, which is on the southeastern portion of Haiti. But so the story begins on March 17th, 2003, and 4 men put together a makeshift clinic and brought a sick man into this clinic in Las Caubas. And the man was 26 years old. His name was Joseph. He'd been sick for months. His illness had started with just intermittent fevers, followed by coughing, weight loss, weakness, and diarrhea. This is probably an example of what happens often in global health, where sick people are brought into these clinics and with symptoms that look similar to AIDS or TB. So he had been sick for months. He had been going all around Haiti. He was from the urban area, which is Port-au-Prince, which is right around there. And he had been going to these clinics. He had gone to several different clinics and was getting treatment, but nothing was curing him. He was still sick. So eventually he thought he was just meant to die, and so he returned to rural Haiti to return with his family and to die with his family. Family members there had been selling everything they had, just as I think any of our family members would do if we ourselves were sick. They sold all their land, they sold all their livestock, they sold everything they had in the effort to get Joseph the treatment that he needed. But they kept on paying, and it just wasn't doing anything. And so the family had even gone to the extent to buy Joseph a coffin, because he was going to die, so they were going to prepare for the burial and the funeral. But just in probably like the last week or two of his life, a community health worker ended up visiting Joseph's house and ended up convincing Joseph to visit this health center in Las Caubas. And this is what Joseph looked like when he arrived at the health center. So this was March 2003. And at the clinic, Joseph was eventually diagnosed with advanced AIDS and disseminated tuberculosis. And so this is a case that we see happening all throughout the world on far too frequent of a basis. J.W. Lee, the former director general of the WHO, said this, quote, that it's difficult to grasp the magnitude of the problem. 8,000 people dying every day from AIDS is equivalent to 30 jumbo jets crashing. I think that statistic really kind of shows the magnitude of the AIDS epidemic, and AIDS is only a part of the puzzle of global health. There are tons of other preventable and treatable illnesses that people are dying from. Here are a few more statistics. 1/3 of the people in least developed countries will die before they reach age 40. There's more than a 25-year gap in life expectancy between those in the wealthiest and poorest countries. In poor countries each year, 500,000 women die in childbirth. 33 million are now infected with HIV, including 2.5 million children. And during the 1990s, the people-to-physician ratio in Burundi, a country just south of Rwanda, was 100,000 to 1. In the United States, I think that, and correct me if I'm wrong, I'm sure someone knows that number, but I think that's around like the mid-300s. So 300 to 1 as opposed to 100,000 to 1. So let's return to Joseph for a second. This was Joseph when he first arrived in Las Caubas, Haiti, at the health clinic. And he was eventually hospitalized in the clinic. He remembers telling his physicians that there was nothing they could do. He was dead already. The medication can't save him. But Joseph got put on treatment. He eventually began to improve, and after several months of therapy, this is what Joseph looked like. And think that well, Joseph's story for one is pretty incredible, because not only did he beat AIDS and tuberculosis, but his symptoms were cured for AIDS, but 5 years later, Joseph had gone on to really, throughout the world at international AIDS conferences, telling his stories. He became employed as a HIV outreach worker in Haiti, and is one of the strongest kind of AIDS activists in the world today. So he went from this to a few months later being cured, and now is suddenly an incredible HIV outreach worker. And I think at the end of the day, this is part of the reason why we're all here to begin with, because we know that this is not what the world needs to look like, and that we have the resources, we have the medicine, we have the money to make this possible, and we know that that solution is out there, and so it's just a matter of making it happen. And so I just wanted to start off with that story, and I hope that'll lead into a bit of a discussion as we all explore the other reasons of why we're here and why we are so passionate about global health. So we've got a few discussion questions, and we'll just have about like 15, 20, maybe 30 minutes to discuss those. Do you want to pass them out, Greg?
Sure.
And so, no, they're all the same. But so we'll just pass these out and meet with your cluster, look over these questions.